Does heart rate recovery after exercise predict survival? Yes, unequivocally. Heart rate recovery is a powerful independent predictor of all cause and cardiovascular mortality. Here is a breakdown of the clinical evidence, the physiology, and how we measure it. Heart rate during exercise is driven by sympathetic activation and parasympathetic withdrawal. Once exercise stops, the immediate drop in heart rate is primarily driven by parasympathetic, that is vagal reactivation, not just sympathetic withdrawal. An abnormally slow heart rate recovery indicates autonomic dysfunction, specifically blunted vagal tone. Because diminished vagal tone is highly arrhythmogenic and associated with a higher risk of ventricular fibrillation and sudden cardiac death, a delayed heart rate recovery serves as a red flag for cardiovascular vulnerability. Heart rate recovery is calculated by subtracting the heart rate at a specific time in recovery from the peak heart rate achieved during stress testing. The cutoffs for what is considered abnormal depends entirely on the patient's position and activity level during the recovery phase. Upright active cooling down. 12 beats per minute or less drop at 1 minute, typical for standard treadmill stress tests. Supine passive recovery. 18 beats per minute or less drop at 1 minute, typical for stress echocardiography where the patient is lying down. Sitting passive recovery. 22 beats per minute or less drop at 2 minutes. The prognostic power of heart rate recovery is well established, tracing back to landmark data from the Cleveland Clinic, which demonstrated that an abnormal heart rate recovery is predictive of death independent of the angiographic severity of coronary artery disease. Heart rate recovery predicts mortality even after adjusting for age, left ventricular ejection fraction, standard risk factors, and total exercise capacity. More recent data links a blunted heart rate recovery to a significantly higher likelihood of having severe complex coronary artery disease with syntax score 23 or more. While 1 minute heart rate recovery is the clinical standard, recent large cohort studies like those utilizing UK Biobank data suggest that ultra early recovery, specifically the heart rate drop at 10 seconds post exercise, might be an even superior predictor of mortality as it most purely captures the initial spike of parasympathetic reactivation. Heart rate recovery is dynamic. Studies have shown that patients with an abnormal heart rate recovery at baseline who undergo phase 2 cardiac rehabilitation and normalize their heart rate recovery see their mortality risk drop back to the level of patients who had a normal heart rate recovery from the start.